I hope you enjoyed and your other sessions were interesting. Remember that all the other sessions that you didn't attend will be available from today after this event and during next month through BHH YouTube channel. So just do not hesitate to enjoy all the other sessions during this month. Okay, now we move on a second show and tell session with more presentations from startups. We will have 6 companies right now. So remember your famous 4 minutes demos of your technological solutions. You will have a countdown just in front of you. And let's start. Let's start with the first company, which is Sequentia. Walter Sanseverino is the CEO and co-founder of Sequentia Biotech. He will be presenting MIC. What is MIC? A microbiome analysis platform for personalized healthcare. So, Walter, whenever you want, the floor is yours, and this is also yours.
Thank you very much, Elena.
You too.
Hello to all of you. I am Walter. And today, in the next 4 minutes, I'll talk about MIC, the first translational microbiome platform. Before to talk about MIC, let me introduce what is the microbiome. The microbiome is the unique set of microorganisms that live in and on us. And this set is very, very important for health because when we have an imbalance of this microorganism that is called dysbiosis, we can have several diseases like chronic disease, neurological disease, gastrointestinal disease. So there is a very big opportunity for patients because if we are able to implement this type of analysis inside their journey or inside their analysis, we can benefit a lot about it. But there is a problem. There is a very big problem in microbiome data analysis because it's very complex, it's very expensive, and you need a very huge informatic infrastructure. And for this reason, we created MIC. MIC is the first digital platform that helps doctors to integrate microbiome data analysis inside their practice. We created a cloud-based solution, and thanks to our innovation, thanks to our proprietary algorithm, proprietary database, we are able to create a workflow that directly gives to the doctors an evidence-based report with actionable results. In this moment, we are selling MIC in 5 different countries, and our clients are using MIC in different healthcare verticals, in gastrointestinal disease with the gut microbiome, in reproductive health and infertility with vaginal microbiome, or for example, in eyes microbiome with, for eyes infectious disease. Why our clients use MIC? Because they use MIC to detect and assess dysbiosis, that is the imbalance, to manage the microbiome during the time where their patients perform a specific treatment, and then they use our platform for a decision-making support system to enjoy about this type of analysis. We, in the last year, innovate a lot the workflow of microbiome data analysis. We created our own workflow, and this is the comparison between LifeNow and what we are providing with MIC. You need a very expensive infrastructure. Our system is cloud-based, real-time, automated, without no upfront cost. You need an expert bioinformatician to code the analysis and an expert statistician to interpret this analysis. Our workflow with artificial intelligence and machine learning is automated. But finally, maybe most important, you do not need to interpret this type of data because our system gives you an actionable evidence-based report that the doctor can directly use, that can directly integrate inside their analysis and their workflow. Thanks to MIC, we have a cost saving up of 75%. We increased the diagnostic yield, obviously, and then we increased the service offering to the patients and scale up clinical services. Our clients are private clinics, doctors, nutritionists, and hospitals. And in case you have microbiome data, you have only one choice, that is MIC. Thank you very much.
Thank you, Walter. It was a pleasure. And let's continue with Dr. Sven Molfinger. Sven is the co-founder of 1,000 Colibris. 1,000 Colibris is a company focusing on the health and well-being of women during motherhood. So what he will present today is Dana. Dana is a software as a medical device solution for the early detection, diagnosis, and monitoring of mental health pathologies. So, Sven,
thank you very much.
Be very welcome here. Thank you.
This is Maria. Maria can be you, your wife, your daughter and sister. As a woman, Maria should be happy to become a mother. But is she really? And does it matter? We started to map all appointments during the matrescence journey. Matrescence is the massive mental, physical and social transformation of a woman when she's becoming a mother and lasts around 4 years. Normally there are around 60 appointments with 7 healthcare professionals. Now the investigation showed that there are less visits than thought. And many of the women never have a contact with a mental health specialist. And this leads to the hard truth. There is up 90% possibility for a woman to experience a mood disorder during motherhood and up to 25% possibility to suffer severe maternal health disorder. But we will never know who is affected. 75% go underdiagnosed and we won't be able to help. Mood disorders and mental health pathology during motherhood have a direct effect on the health and well-being of the mother and our capacity to take care of the child, with potential long-term negative effect both for her and for the baby. That's why we created Dana. Dana is a digital assistant to improve the well-being and the mental health of the mother during motherhood. On one side, Dana is a digital assistant for the individual to empower and inform her with specific features to help her to release her pains and her needs. On the other, a software as a medical device and a digital therapeutic solution for the healthcare system. Our IP is the Motherhood Vitality Index that is following the mental health and well-being of the woman during the 4 years journey that has been developed with top universities. We built a scalable architecture for the early detection, diagnosis, and monitoring of mental health pathologies during motherhood that can be scalable to other countries from start. We launched our first MVP in March 2021, created 30 psycho-educational programs and tested them with users with more than a 70% efficacy. We launched a second MVP now in September to continue to work with the users and then get more information to build a first layer of artificial intelligence. Next year, we will start to build the software as a medical device interface and continue the pilots and clinical studies. Objective 23, achieve the digital therapeutics and medical device certification. We're working with the hybrid business model, launching an app to gather user data that we will distribute as a B2B2C with healthcare professional with a revenue share model, and then move towards a software as a medical device and digital therapeutic solution in the future. Veronica and myself launched Digital Venture in the past and had the opportunity to lead international companies in different countries. We are blessed to be backed by an intergenerational team of experts in big data, analytics, AI, chatbot, perinatal psychology, mental health, and mobile development. Let us fight mood disorders and mental health pathology during motherhood. Together, we can cut this number by half in 4 years and offer to the healthcare sector a diagnosis and monitoring tool for the patients. The market is huge, and together we can help the life of millions of women, their babies, and their families. Thank you.
Thank you, Sven, for your presentation. Now, next 4 minutes of glory goes to Universal Doctor, the global digital health company. Jordi Serrano, his CEO, will present UHDA Health. Is that correct, Jordi? UHDA Health is a Universal Doctor spin-off with the mission of uniting and democratizing digital health. Right, Jordi? Thank you. Welcome to the stage. This is your mic, and your 4 minutes start right now.
Thank you. It was a kind of surprise. I thought we would speak later, but thank you very much. And you pointed that well. We are a spin-off of Universal Doctor. No? I was waiting to listen to UDA. What is UDA? Universal Health Digital Access. Okay? We want to have a company that really delivers, no matter the budget that you have, the digital health solutions. This is very important. What do we offer, or where we come from? We come from a team, amazing team of Universal Doctor. We have Fernando Vaquero, CTO, Janine Lemaire, working with these people during 10 years in many international with many international organizations, countries, hospitals. We have here Ricky, an amazing guy that knows every innovative project. We have Elsa here that is wonderful in all this biotech world. We have Patricia here, he spoke in the morning, chief patient officer of Universal Doctor, and now UDA. The team is super important. That's why I'm wasting a lot of time, no, in that sense. Now we have all this background and we're using it to launch new initiatives. We have all these own tools like the translator. We have all these tools done by international organizations, by governments. Now we launch the app of citizens of Andorra, no? The app, the equivalent of other apps here in Spain. We have the citizen app of the Andorran citizens, which will allow us to do things that before were impossible with engagement of patients in that sense. Now UDA offers a package that is clear, doing implementation of evidence-based digital health solutions, or own solutions, or other solutions. We have here later other people's platforms that we can really make packages and implement it as a monitoring healthcare system, as a studies healthcare system, or a virtual visits also, of course. But we have all these two platforms, monitoring and studies, that have been already implemented in different places. And moreover, in what we are super excited is to offer these services. We are already offering that in many different places, at least 5, 10 hospitals and some countries. We're offering them statisticians, epidemiologists, researchers, data scientists, starting to do that. And this is the point. And what else? Patients. From the beginning, this is super important, not later, from the beginning, is this combination of that packages, okay, the software plus the services that make us quite happy, and we are open to collaborate with any platform in that sense. The technologies, remote patient monitoring, as you will see, it's already implemented in some cities. The studies, we started before during the pandemic with a platform called Epidemics. Some of you know, in a solidarity way. It's being implemented in many places, and now we are just having a lot of requests from these places to even professionalize more and more, to collect data, to compare the data with other collection tools, and to basically do studies that really, for example, for long COVID, no, really focus in patients, most important way, no? That platform already implemented, for example, in the city of Castelldefels. We will do the Healthy City Excellence. That platform already implemented in X, Catalonia Central, in Andorra, in other places. Now will be used by international organizations also. And basically, we work together, for example, here with the German company, to customize this. That's Christian Blind Mission, that's Handicap International at a very important level. And basically, working together with the combination of other Legos, implementing them, and basically co-creation the process. You are invited to do that with us, and work with us to implement your own solution if you want, and give the solution to everywhere and everyone that needs it, no matter the price, fair price for you and for them. Thank you very much. Thank you.
Thank you. Thank you very much, Jordi. And from UDA to Lighthouse, we have here with us Esteve Vilella, his CEO and co-founder. And Esteve, I think you will be presenting, it's a We Share Care, right? The platform for continuous care. So you can start whenever you want. Just a second. It's okay.
Yes, it's okay.
And just pressing here.
Yep.
All right. Yeah, you can go ahead. Thank you.
Well, thank you again, GHH and Christian Stian for this opportunity. Not working? Working?
Yeah, just a second, please, because we will change your mic. Event on live, physically here. So, but
No problem.
Now go ahead. We can start again in
Okay.
4 minutes, okay?
Thank you again, BHH and Christian's team for the opportunity for presenting our initiative, We Share Care, that we launched in Massachusetts, in Boston. Well, what is We Share Care? We Share Care is a cloud-based business platform when monitoring and continuous care. We use our strong network of the partners, and we use artificial intelligence technology for this objective. Our first statement is We Share Care connects the user's needs with certified caregivers at any time, everywhere. This is an holistic vision for We Share Care platform. It's a strong partnership with Connect with the APIs, and then we have a conversational app for the customer or the users, and we have a franchise business model when we have a franchise app and a control app for monitoring all the business model and the functionality for our partnership network. Okay, well, this is a look and feel of our user app, but you can show the avatar control system, dialogues, and AI technology that we put in order to obtain advantage and functionality for monitoring and continuous care. Well, proof of values, user proof of values, and caregiver proof of values. We connect several stakeholders in the ecosystem for getting advantage or functionality for monitoring in continuous way. Well, our main target, we are working with the nursing homes, with hospitals and insurance and pharma and biotech laboratories. Well, we choose 3 case studies for Fonsanta Soler, which is a real case in nursing home, but we get a tool to assist in digitalization of resident monitoring tracking, optimization of caregiver tasks, and immediate updating of resident records. And we collaborate with Eurecat for a Never Home Alone. It's a next generation EU funds for obtain a co-design of social intelligence assistive robot, because we have a lot of interfaces for connecting the users and the caregivers. And another is a huge collaboration consortium with San Juan de Déu, Tufts University from Boston, Affectiva, and Cima Robots for validate the use of their social robots and a social connector at home between the patient, family members, and the healthcare community. We are very, very proud about our collaborators. We have over 16 companies that connect their functionality with our platform. Then extend our functionality in other in more country, increase the commercial activity, and increase the investment. This is our nowadays franchise networks in the USA, Panama, Spain, France, Switzerland, and India, and we are working for 4 countries more. This is a strong team of advisors from Cambridge, and we are a rocket star for this initiative in Wish. Very much, and we are open to collaborate.
Thank you, Esteban. Thank you very much. Let's continue with Fosanis. Pablo Prieto is the Chief Revenue Officer at Fosaris, makers of the Oncology Digital Therapeutic Solution, which is named MICA. He will present MICA and its integration in a care setting as complex as cancer with Germany's DIGA model. So, Pablo, welcome on stage.
Thank you very
and
much.
Here you have your presentation. The time is yours.
Thank you. Thanks for the invitation to present MICA. My name is Pablo Prieto, as was said. Before we start, I'm going to tell you a little bit of a story. I think it's a story that pretty much everybody can relate in this audience. Either you've lived this on first person or through friends or relatives. It's a cancer of story, in this case, Claudia is not an artificial person. It's our head of marketing based in Berlin. When she was 38, about 12 years ago, she was diagnosed with leukemia. You can understand, as I said, the moment of diagnosis of cancer at the age of 38, then undergoing a lot of chemotherapy cycles, then bone marrow transplantation. All those difficult treatment decisions, the lack of energy, the difficulty in communicating this to family and friends, and so on. But now she's back to work, and she's still facing a lot of the difficulties in coming back to work with full strength. So it took not only the best drug treatment to overcome cancer, but also a ton of resilience, and a lot of empowerment to make those decisions, hard decisions sometimes. So that's what Mika is all about. Claudia's passion, as you can see on this picture, it speaks for itself. I mean, it is our passion to try to get cancer patients to that level of empowerment. So really, what is Mika? So Mika is a digital therapeutic. It's not a wellness app. It's unique to each person. We tailor the experience using two elements. The first one is monitoring. So we measure symptoms and the level of stress or distress that each patient is suffering at a given time. And then we use that with the cancer type, the stage of cancer that you're at, where you're in diagnosis and treatment and so on, all the way to providing courses, journeys that are using psycho-oncology as the basic support. And as I said, this is a digital therapeutic, so that means that we're a medical device. The DIGA regulation means that this is interoperable. There's a ton of privacy issues, and there is clinical efficacy. We have 5 clinical studies. The results from the pilot study are shown here. There is a decrease in fatigue and in distress that is very significant, and we're proving that in other studies. So we've hit a number of milestones that we consider very important. We're the first cancer DIGA in Germany. DIGA, for those of you who don't know, is a scheme where social security systems in Germany fully paid for the treatment with Mika. It's approved for all cancer indications, not just a single one. And this is because we're grounded in psycho-oncology. We have pharmaceutical partners, patient care partners, and hospital partners. So our business model is very much grounded on partnerships. We have already tremendous growth and revenue, pretty good engagement, and the team is actually a team of 30 people that are very passionate, as I said before. What's ahead of us? So we're going to be expanding into other countries. So I'm here looking for partners and investors who want to be part of this super exciting journey to empower patients and bring them to a whole different level. Based on our pricing and patient populations, this is a 5 billion market of digital therapeutics in oncology in the EU5 alone. If you consider partnerships, engagement with pharma partnerships has been tagged at 2 billion globally. So there are very big markets that we're trying to tackle. I think we're at the forefront, being a DIGA, with all the regulatory hurdles being cleared, and now it's about growing. We have a very strong culture of people. We focus on people. I think this is proven by Claudia, but many other people. We have oncological nurses, we have psycho-oncologists in our team, and we're willing to grow this internationally with exactly the same philosophy, working with patient associations and co-developing the solution together. And last but not least, our business model is one where evidence and access is key. So we're going to keep on doing that. Thanks a lot. My contact details are in the platform.
Thank you. Thank you very much, Pablo. And the last one regarding this second breakout session is Xavier Oleart. Xavier is the chief of Edrix Healthcare, a company focused on enhancing human and technology innovation in the healthcare sector. He will introduce a collaboration model between pharma and technology companies and hospitals and public administrations. So, Xavier, welcome. This is your 4 minutes.
Thanks very much.
Thank you.
Yeah. Does it work?
Yeah, it is.
Right. Well, hello, everyone. My name is Xavier Oleart, and I'm the project director of Edrix Healthcare, our company. Since we only have 4 minutes, I'm not going to use any slides. I just want to focus on explaining how we can help your organizations. We don't have a product we sell, but we offer solutions basically to hospitals based on value for patients and for professionals. Just to imagine how we work. Edrix Healthcare at the moment is working in Europe, but also in Central America, and next year we'll start working in South America. But what we do is, I invite you to imagine a triangle, and in one vertex there's healthcare professionals, patients, hospitals, the healthcare administrations and medical societies. On the other corner of the triangle, we can put great startups, companies with solutions that need to be implemented in hospitals. And in a third vertex, we can put the pharma and the medical devices industry. We are in the middle of all these companies, and we facilitate the implementation of projects, basically. Just to give an example, a year ago we were in a pharmacy service in the south of Spain talking with their chief of the pharmacy service, and he was talking about the difficulties they had with all the pandemia situation we've got at the moment to improve the patient flow, to increase security in the hospital, to avoid many people being together. At the moment, we are developing a project based on facial recognition together with a company that till last year only worked with banks. At the moment, they are also working with hospitals, and this is a great solution that all our team together with the team of the hospital developed. Another example, now we are developing a platform for training for healthcare professionals using some algorithms based on artificial intelligence. Now professionals can practice clinical cases talking with a screen instead of only reading or practicing with some buttons in a screen. Other projects that we've got, now we are working hand to hand with the Spanish Health Managers Society to improve, to boost innovation into hospitals, to help health managers understand how they can implement artificial intelligence, new leadership models, not only in the theory, but with cases that they can easily implement. And on the other hand, all this was about digitalization and technological tools, but we also work with humanization, and this is probably even more important. Patients are, at the end, the most important of all the system. Is the reason why we all work. Now we've got a certification in humanization. We've been in more than 70 hospitals this last year here in Spain and in Mexico, and we only try to facilitate the implementation of specific measures that improve the quality of care offered to patients and the quality of the offered to professionals, helping them implement small things that can be a great change. If you are interested or we can be of your help, you can find us here in the Barcelona Health Hub building in Barcelona, or you can also contact us at hello@edrix.net. hello@edrix.net. That's it. Thanks for everything, and see you soon.
Thank you. Thank you very much, Xavier. Thank you, all of you, for your very, very interesting presentations. Now, show and tell second part has arrived to its end.